Assalamu alaikum wa rahmatullahi wa barakatuhu, our beloved viewer, MTA for Africa. This is your program once again, Healthy Check, a program where I will bring medical personnel to share a few information that regards our lives, that helps us in as far as our health is concerned. And today, like in the previous episodes, we're still discussing eye diseases, and today we are going to be tackling the cataracts. We are tackling the cataracts. And what are cataracts? This is a disease that brings a cloudy something, a blurry vision to your eyes, and it can cause blindness, like the doctor explained to us in the previous episodes. And we wanted to enlarge or to give you more details about this program. And since I'm not an eye specialist, I won't go further explaining this. I had to call in our brother and a doctor, that is Dr. Abubakar Kalinachi, to come and expound a bit more on what a cataract is. So, brother Dr. Abubakar, you're most welcome once again. And together we'll be with our later on in the program, of course. He's online and he will be following us till we call him in. That is our brother Hussein Chiyinji, who is an eye clinical officer. He will be joining us later on to help us enlighten our viewer in a few of the questions that we'll deliver to him. We are discussing cataracts.
Yes, please.
So may you please explain a bit more of what a cataract is?
Thank you very much for inviting me to this program, and to allow us a chance to educate the viewers about eye diseases. In most of our health promotion or education talks, we talk about the major causes of blindness. Cataract is the major or the leading cause of blindness worldwide. The major or number one cause of blindness worldwide.
Okay.
And the major type of cataract that causes blindness is the age-related cataract. Whoever grows older, it's like a must. They should get a cataract.
They have to have cataracts.
Just like you have gray hair that develops on us as we grow older.
Okay.
The gray hair for the eyes is a cataract. What does it mean to the viewers? It is something that is inevitable nearly. If someone clocks 60,
it is on the way. It is
on the way. Even us who are doing eye surgeries and everything, we respect patients we work on, because if you grow older, we shall become patients who will need.
So you need to train more.
So we train more
doctors.
And also handle these who have cataracts carefully and with a lot of respect. So cataract is the clouding of the natural lens. We have our eye here.
Clouding of the natural lens.
Yeah.
Explain what a lens is, as you're going to show it to our viewers, since we have the eye with us today in the studio.
This is the eye. It's an eye model. This lens that is natural works like the lens in the camera. So this lens has to be clear like glass.
Okay.
It's like glass, actually.
So we're talking of the lens.
Yeah. What the main function is to focus light on the retina, on the back of the eye, so that we can see. So this lens that is clear, if it becomes cloudy, like here.
Just a moment. Show us the lens again.
These are two lenses. The lens is in the eye here. It's clear like glass.
Okay.
If this lens becomes cloudy, like this, it means light does not go through this.
Okay, the one that is cloudy.
Yeah. So the clouding of the natural lens is what we call a cataract. Viewers sometimes are confused about cataracts. They think anything white on the eye is a cataract. So this natural lens is clear like glass. If it becomes cloudy,
okay,
slowly it gets cloud actually, with age mostly.
So those are two lenses. One is cloudy, one is clear.
Yeah, this clear one is a natural lens,
okay,
in its normal shape and transparency.
Okay.
However, with the cataract, it becomes cloudy. So if it's cloudy, it goes on progressively becoming white.
Okay.
That's why if it's in the eye here,
Yes.
you'll see something white. Where there's black spot,
Yes.
it becomes white.
It becomes whitish.
That is when the cataract is mature. Okay?
Yes.
However, vision is actually bad by the time it's white. Light does not go through the eye to the back of the eye. That is
Okay.
so that's what we call a cataract. And the major cause of cataract is age.
Age.
If you grow older, you have more chances.
So do you have any anti-aging something like that
For-
we can take so that we cannot get old?
One thing you can't fight is age. And if age comes in, you have to accept.
I hope that
So-
message is heard by our sisters who try to fight it.
Why am I talking about age? Many of us have parents, we have grandfathers, grandmothers, we have neighbors at home who are blind. And we think they are permanently blind, yet they have a chance to see again. So long as you take them for an eye check, and if they confirm that they have a cataract, it's treatable, they can actually regain their vision back.
Okay.
So if you see someone 8 years and above, 50% of those who are 8 years and above have a cataract, or they have been operated on for a cataract.
Doctor,
Okay.
when are you most likely to have a cataract?
Number one is if you're 60 years and above, you stand high chances of having cataract.
Okay.
However, there are some other types of cataracts or other causes of cataract. One of them, if someone has injury to the eye, they can have a cataract either immediately or within a week, or it can occur after a year. This does not put age into consideration.
Okay.
If someone has impact injury on the eye, that impact or injury may cause a cataract very soon. Number two, some diseases can cause cataracts. For example, diabetes. Those who are diabetic can have cataracts.
So if you're having diabetes, you're at high chances
high
of
chances
getting
of having cataracts.
cataracts.
Yes. Those who have type 1 diabetes, the young ones, even age of 20, 19, they are blind from cataracts. Okay? If someone has diabetes and their sugar levels are not well controlled, they can get cataracts at another age. 35, 40, they have cataracts already.
Okay.
But number one risk factor and cause is aging. Okay? So cataracts, being the leading cause of blindness worldwide, it's an issue of concern. It's actually have a backlog of many cataracts that are not being worked on because of increasing numbers. Every year people are getting older, and in Africa, unlike in other countries, the burden is so high because the cost of surgery is quite a lot of money.
Okay.
And most of us can't afford this money. So that's why in Africa, in Uganda here, most of those who are poor benefit from eye camps, where we go to the villages. I myself, I have an experience of, I think, the only last year, I think I did over 600 cataract surgeries. But these are mostly through eye camps.
Okay.
We go to those who are needy and do these surgeries.
Okay.
So, dear viewers, as you think about blinding conditions, number one cause of blindness is cataract. So if you see someone who is blind, the first thing you think about is cataract.
Cataract. Okay, doctor, let's now talk about the symptoms
Symptoms of
of cataracts. How does one realize that maybe I have or am maturing this disease?
Fine. A symptom, of course, is something you feel. So number one symptom of cataract is decrease in vision. And this is progressive and in most cases painless.
Okay.
Someone has no pain, but they are losing vision slowly. At first you may start losing color vision. For example, you go and you want to put on your stockings, you can't tell whether it's blue or green. It's others who say, hey, mister, you have non-matching colors. So you lose vision slowly, progressively over time. Two, you lose color sensitivity, differentiating colors, especially blue and purple. You cannot tell if the cataract is growing. If it's a bit cloudy, you may be able to see well, but there's a brown tint on everything. Okay? You don't see things clearly. The other symptom is glare sensitivity. Glare. Anything that is producing light. For example, if you're driving at night, okay, and you have an early cataract, you cannot withstand light from a headlamp of a coming car. Even these lights here, you find it difficult to look at light because of glare sensitivity. The other symptom is You lose contrast sensitivity. Contrast is ability to make sense of what you're seeing against either white or black background. Okay, so you lose what we call contrast sensitivity. The other symptom you may feel is double vision. If you close one eye, someone may have multiple images because this natural lens that I talked about, if it becomes cataractous, there is scattering of light in the lens, and this scattering causes production of multiple images on the retina. So someone sees 8 eyes on you, they are seeing many teeth on you because of the cataract they have.
Okay.
But this goes on slowly progressing depending on the severity of the cataract. Early cataracts, there are few symptoms. As it advances further, you actually get blind, completely blind from a cataract.
Okay. Doctor, let's now talk about, as you explain, some different types of cataracts.
Okay.
Yes.
Number one is age-related cataract that comes due to aging. Number two, you have traumatic cataract. If you have trauma to the eye, injury to the eye, you have high chances of getting cataract. Number three is congenital. I hope you remember that congenital. There are kids who are born with cataracts. And in the earlier episode, we talked about amblyopia. One cause of amblyopia is a cataract in a child who is young. So someone can be born with a cataract. Number four, we have what we call metabolic cataracts. If you have diabetes mellitus, you can have cataract at an early age. Some diseases like HIV can also predispose you to having cataracts. We have some predisposing factors. If someone is smoking, cigarette smoking, tobacco smoking, increases chances of you having cataracts. If someone is taking alcohol, he also increases chances of what? Developing cataracts early. So those are the types of cataracts. They all cause one thing: decrease in vision and visual acuity, and then later blindness.
How would you detect a cataract?
Thank you very much. The first thing is we ask you when you come to us, how do you feel? One of the symptoms is I have cloudy vision. I can't see someone at a distance very well. They have to first come closer. Someone tells you it has been coming in slowly until now I cannot see someone's face. So when you come to us in our clinics where we work or in our offices, the first thing we do is to take what we call visual acuity. We assess how much vision you have. This measurement of vision helps us to also decide whether you have visual impairment. If someone has an early cataract, we can give it time to grow until there is some degree of visual impairment. So you have a chart where we ask you to close one eye, read those numbers or letters up to some level.
Okay.
So at some point we can tell that this cataract here, I mean someone has decreased vision. Then from there we can actually go on and examine the eye thoroughly with our machines, what we call slit lamp. It can examine the eye from the front part to the back of the eye. And here we can see the natural lens with our machines and see if it's cloudy or not. If it's cloudy, that's a cataract.
Okay.
Then the visual acuity tells us the degree of impairment someone has. And after that, we can also do other checks, like taking the eye pressure. We also look at the back of the eye to see if there are some other issues in the back of the eye. We look at the eye in a comprehensive kind of way, but a diagnosis is confirmed if we see the natural lens is cloudy using our machines.
Okay.
Yeah.
Now, Doctor, in the previous episode, you told us that with glaucoma, once you're blind for good.
True.
Yet, the number one cause of blindness is not glaucoma.
True.
It is a cataract.
True.
Is it the same case with glaucoma, that once we have found or we have diagnosed a cataract in you, your eyesight is gone for good?
The good news with cataract, unlike glaucoma, is cataract is treatable.
Okay.
It's treatable, and if someone has no any other complications in the eye, they can regain their vision very well through surgery. That we wash out this cataract and then implant some lens in the eye, and you can see and have your vision back to you.
Okay.
So that's the good news about cataracts. So whoever is there with all people who are blind, if someone has a cataract and we confirm they have a cataract, there is a chance for them to see again. And me as a person, the source of my happiness and satisfaction is when I help someone see again.
Okay.
And even if it's not money, or if someone sees again, I'm happy seeing them see again. So if someone is blind and they have a cataract, there is a chance for them to see again and even get back to work.
Thanks a lot, Dr. Abubakar. Dr. Hussein Chinji, our eye clinical officer, I'm turning to you now. We've heard of glaucoma in the previous episodes, that once it comes, it is irreversible. But I'm looking at a stage where someone is having glaucoma, not at the upper stage, of course, but is developing glaucoma, and at the same time is having a cataract. Is there some conditions that do not require a surgery when I have, let's say, glaucoma, or some other conditions that may not allow me to go for a surgery, Dr. Brother Hussein Chinji?
I'm called Hussein Chinji, a doctor of eyes specifically. Now, as you posed that question, that are there conditions that do not require surgery. Now, I can simply answer that by saying surgery is just a form of treatment that we consider just according to the condition someone has presented with. There are conditions whereby surgery is the only option, just like a cataract. If someone is having a cataract and it is the cause of blindness, surgery is the only option. There are conditions whereby surgery is not the only solution, or surgery cannot be considered as the first line treatment. Conditions like maybe retinitis pigmentosa. It is just some genetic condition of the eye. We cannot consider surgery in that condition. I can as well tell you that there are conditions which on its own does not require surgery, but considering its complications, we can consider surgery as a way of treating. Conditions like maybe allergy of the eyes. On its own, surgery is not a treatment, but its complications can be handled by surgery.
Okay, thank you so much, our brother and an eye clinical officer. That is Brother Hussein Chinji there for you. Doctor, now, you have given us good news. There is a chance of seeing again for those that have cataracts, unlike those that have glaucoma. But when we talk of a surgery, because you have told us that's the only way that you can treat cataracts. When you talk of surgery, most especially here in Africa, I don't know if it is the same in Europe or elsewhere, but people are scared of surgeries. What are the risks of taking surgeries in as far as preventing or treating cataracts is concerned? Yeah,
the good news about cataract surgery, first of all, it's the most performed surgery worldwide.
Sure.
The most performed, if you think about surgeries in general, the most performed surgery is cataract surgery.
So you have no shortcut that we can use, but surgery.
Then two, it's one of the safest surgeries, I should say.
So you're trying 90% to run away from my question.
I'm not running away, but of course it is scary if you talk about surgery on the eye.
Yeah, I was asking for the risks.
Most of the viewers, when you talk about cataract surgery, think about removing the entire eye from the socket and then you put it on the side and take it back. We don't remove the eyes, no. We go through some small opening and wash out the cataract from the eye and implant a lens there. We give some anesthesia to the eye so you don't have any pain. It's one of the safest surgeries if it's done by an eye surgeon, not someone you think about on the streets. And we also take precautions to make sure you don't have risks. However, there is no surgery without risks. Any surgery has risks.
Okay.
No doctor can lie to you that I give you 100% guarantee that everything will go well. So there are risks, of course, there are few, but your doctor will do a very good assessment to see that this surgery is not risky. If I'm going to do surgery on a patient...
So this reminds me of the advice that you shared with us, that when you have any eye problem, you have to go to an ophthalmologist alone. Not every doctor can do eye surgeries.
Not like that, but it's only an ophthalmologist who can do surgeries. The other lower cadres don't do surgeries.
Okay.
Yeah. But they can help in diagnosing, they can help in assessing, but the one who does the surgery is the eye specialist.
Okay.
Yeah.
So you have to go to the eye specialist.
Whoever diagnoses with a cataract will advise you and refer you to the eye surgeon they think will help.
Should I assume that immediately after the surgery I'm going to get my vision back?
In most cases, after surgery, we can put some strapping on the eye, then tomorrow we remove it. Most of the patients have vision after
a day.
A day, yeah.
Okay. So after a day you can have your vision again.
Yeah.
What can one do if they already have lost some vision from cataracts?
They have to go for an assessment and you discuss with your eye doctor. This surgery is not an emergency, by the way. We have to prepare you psychologically, then we also have to take some measurements. One of them is to assess if your vision has some degree of impairment. And then we can discuss together and decide whether you need surgery or not.
Okay.
So if you have some cataract and it's causing vision impairment, we can still go for the surgery.
Dr. Boubacar, you and I both agree that we are Africans.
True.
And the preventive measures will help us a lot than curing some diseases like a surgery. It's not something that are going to spend a few coins on it. So are there any preventive measures that we can take to prevent ourselves from attracting this disease?
There are a few preventive measures. For the age-related cataract, the only way you can prevent it is stopping your age, the clock that...
which is impossible.
Which is impossible. However, we can avoid early progression of cataracts by having protective wear, because the sunlight, UV light from the sun, increases the chances of developing cataracts early, faster. So if people put on shades in bright light, it's not only about fashion. It's also preventive. Then the other, you can prevent cataracts by avoiding risky sports activities and having protective wear if you work in environments where there are some stray objects, okay? I've had boda guys, those who ride motorcycles, where an insect hits the eye on high speed and they get cataract. Okay. So why should you move out without protective wear? Me, if I'm on a motorcycle, I move with my glasses. Any impact on the eye can cause a cataract. So you can prevent that from happening. If you're diabetic, if you don't want to develop a cataract, make sure you have well-controlled sugar levels.
Okay.
So your diabetes doctor should help you control the sugar levels as much as possible. This prevents you from getting cataracts early.
Yep. Doctor, time has not been our ally since the start of the series of this program, and to this point I'm going to ask you to have a few concluding remarks with our viewers, some advice in as far as preventing their eyes from these cataracts is concerned.
Yeah, thank you very much. We cannot exhaust everything in a talk show. However, as I said earlier, cataracts are treatable. If you have a cataract, there is good hope that you can have treatment and have your vision back. You just need to have a good assessment by an eye healthcare worker, and then they can see if you can benefit from a safe surgery. Then two, you should be ambassadors. If you have someone blind close to you and you've heard about this talk show, you can bring hope to them by, referring them to where they can have an eye check. Surgery in the Kampala in the city center is very expensive, like $500, $7,000, even $1,000 per eye.
That is one eye.
One eye. So donors can also think about impacting lives by restoring vision through supporting free cataract surgery camps.
I hope all the donors are watching. Islam says, Allah subhanahu wa ta'ala says that if you save a single life, it's as if you have saved the entire world. And I hope each and every Muslim would wish to have saved many lives, because in the end, Allah subhanahu wa ta'ala will save yours as well. We can't go beyond this. I've told you before, and I'm telling you again, that time has never been a good ally with us. And I'm going to put today's program to a close at this very time. And I remain your host, Nambale Bashir. Until we meet in the next episode, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.